Our first guests are better known in the area as the vein doctors. They've recently wowed us in the past from results from all of their patients. So you know what? I decided to try it myself. Dr. David Calcagno and Dr. John Rossi join us. The Calcagno and Rossi Vein Treatment Center has been in business for more than a decade now, and you are the vein doctors. You are the place to go. And so, yeah, I went. So you performed a treatment on me last week. Dr. Calcagno, explain to folks what you did.
Well, you had spider veins or telangiectasias and also sort of flat blue-green colored veins called reticular veins, and we injected those with an irritating solution which is called sclerotherapy to get rid of them.
So here we are. I didn't even think it was that bad, but thought, you know, let's get this taken care of before it gets worse. I can tell you, it didn't hurt at all to get this done. And there were times when you told me you were injecting and I couldn't even feel what you were doing. Would you call that a success?
Yes, your procedure went very well. It's the smallest needle made, so it's generally not a painful procedure.
It's fascinating to watch. You can actually see the, what is it that you injected? What's the
sclerosant? Mm-hmm.
Yeah, you can actually see it working.
Yes.
As you watch. It was pretty fascinating. Is that something you typically do for a lot of patients?
Yes, quite a large part of our practice is broken up into either the sclerotherapy for the small veins or what Dr. Rossi will talk about in a minute, procedure for large varicose veins.
Look at that. You really can just see it almost vanish at some point. Look at that. Isn't that crazy? Well, not for you, I guess, but for me to see it, it's really quite fascinating. Dr. Rossi, talk about the VenaSeal, because this is a big deal for you guys.
Yeah, Dave mentioned that a lot of what we do is for symptomatic varicose veins, the larger veins, and we treat venous reflux a lot of times by ablating those veins or by closing them off. And this is a really nice new technique because now we can treat those with a tiny little catheter. This is actually the VenaSeal catheter. And we can put this through a small puncture in the skin after the skin is numbed up, and then we inject a special glue that now basically will glue the vein shut. And so you back this catheter out, glue the vein shut, put a Band-Aid on the patient's leg, no stocking, nothing, send them home, and their venous reflux has been treated. It's really fascinating, really an incredible advance in the treatment of vein disease. We're really excited about it.
Let me ask you something that maybe another viewer might wonder. Is it permanent? Can that glue come like unstuck?
Right, the glue, basically what happens is the glue and the vein then get absorbed and the vein just disappears. So if you look at these patients with an ultrasound, several months later, there's nothing there, it's completely gone. And this is a little video showing what actually happens with the glue procedure, the VenaSeal procedure. So the catheter is in the vein, the glue gets injected, and the vein gets compressed, and it basically glues the vein shut. It's a similar compound that's used to glue in joints and knees and so forth, but it's soft and it's stretchy, and it's a modification of the technique, so it really works great.
And then explain how it's different from the sclerotherapy.
Well, the sclerotherapy would be for very small, tiny, visible surface veins.
Okay.
What John is talking about is if the saphenous vein, the main surface vein of the leg further down that you can't see with your eye but can see with ultrasound, if that has valve leakage, then John will use that procedure.
This is so interesting. Folks can learn a lot more at an event that's coming up on the 10th that I'm going to be at. So tell me about the screening. Yes,
we're having a vein screening on Thursday, May 10th. Call for an appointment so we know you're coming.
Sure.
And at that screening, we're going to do a quick ultrasound to answer specific questions that patients may have about their particular vein problems.
Right. And that's how you can explain more about which procedure might work better, if they need a procedure, and then if so, which one works for them. So I'm going to be there around 2 o'clock that afternoon, so you can come and chat with me and I can tell you more about my experience. And also Sue Campbell from Wink 104 is going to be there. And she's been on the show here sharing her experience before. I just want to point out with the VenaSeal, you were the first in this area to be able to do this, and you've performed more than anyone.
Yeah, we performed quite a few of these. We were the first, we're actually the third physicians east of the Mississippi to do this.
Fantastic.
And we've performed more of these than anybody in the state of Pennsylvania to date. So we're gathering good experience and the results just seem to be excellent.
Wonderful. And again, on May 10th, you can get more questions answered and learn more about the procedures. Guys, thanks for being with us. I'll see you in a few weeks.
Thank you.